Good morning. Recording. Okay, so we're starting with cardiovascular, and I know you guys have talked about this a little bit in terminology, and that's why I put that little thing in the email. Your terminology book is kind of like a summary of anatomy. There's actually a lot of anatomy in that book. So if you're reading your anatomy book, which I hope everybody does, I know sometimes I know the chapters can be complex at times, but if the terminology book might help give you a summary of what we're talking about. So I would just say go ahead and check that out if you need. But when we're talking about cardiovascular system, the heart is connected to a series of blood vessels. It's all connected. And I think of it a lot of times in this section, I'll use like the water company as an analogy. The Indianapolis Water Company has these big pumps, and it has to pump water to all the businesses, houses. If you think about your house, you have a very small set of pipes, but it comes from a very large set of pipes, and then it's diverted out. If I think about the heart, it is pumping constantly, and it is pumping blood, and it works in a figure-8 system. And the vessels that we're going to talk about are arteries and veins. So it is a set of arteries and veins. Think about your house as the capillaries, okay? The blood has to get oxygenated blood to every tissue in your body. That's like to your kidney and your pinky toe. Like oxygenated blood goes to every spot. So it's going to, when it leaves the heart, it leaves at a very large part, which is the aorta. And then it's going to branch into smaller arteries till it branches to a capillary. Anytime I talk about a capillary, I'm going to be talking about that's where gas exchange occurs. So when a capillary goes to your tissues, say the kidney, your toe, your finger, wherever, it's going to drop off oxygen. And then that tissue has carbon dioxide, which is a byproduct of cellular function. It's going to pick up carbon dioxide and bring that back to the heart, because when the blood goes to the lungs, you exhale carbon dioxide, and that's how you get rid of it. So at the capillary level, this is where the body's going to exchange the oxygen for carbon dioxide, and then it's also going to give off nutrients and pick up other waste. The other way I think about the heart is like a road system. You're leaving a very big area and you're dropping stuff off. When you get to someone's house, you drop off something. That's like a capillary. You pick something up and you go back on the major highways. So the cardiovascular system is like also a transit system to deliver oxygen and nutrients, to pick up wastes and transport them where they need to go. So when I talk about arteries are going to always have oxygen in them. Veins are always going to have deoxygenated blood or rich in carbon dioxide. And then a capillary is where both will meet. So the capillary is the most terminal branch that we're going to talk about. So I'll build on this. And this is what I was kind of talking about. It works as a figure-8 system. Anytime you see a picture of the heart and you see the color blue, that is representing a deoxygenated blood. It does not have oxygen. It's rich in carbon dioxide. When you see red on a picture of the heart, so this right here is all blood that is oxygenated. So what it's doing here, I'm just going to give you an idea, and we're going to keep saying this over and over again. This is the left side of the heart. So this is the left atrium, down here's the left ventricle. This right here is the aorta. So when oxygenated blood, the first place oxygenated blood leaves the heart is the aorta. The aorta is going to branch right here, and this represents the top half of the animal. This represents the bottom half down here. So that's what I'm pointing at. Some oxygenated blood's going to go up here, some's going to go down here. So this is this is the liver, this is a spleen, this is a kidney, this is the back leg. Drops off oxygen, picks up CO2. This stuff that looks like nets, do you see how it looks kind of like a net? That's the capillaries, okay? So here drops off oxygen, picks up CO2. Now these are veins. Every one of these areas has veins that are going to go back to the heart. So they go through here, which this is the vena cava. The vena cava has a inferior and superior, or I call them cranial caudal. This is the cranial vena cava, caudal vena cava. They empty into the right side of the heart. The right side of the heart then is going to pump to the lungs, takes the blood to the lungs. At the lungs, what do? We're going to drop off CO2 and we're going to pick up more oxygen. When it comes back from the lungs right here, it goes back into the left side and it starts the cycle all over again. That's why they kind of call it a figure 8, okay? So this is happening constantly, or you would not be alive. So as long as your heart is pumping, it is being circulated, is going to all of these tissues. If you hear me say pulmonary circulation, the word pulmonary is pertaining to lung. So that is the circulation from the heart to the lungs. If I say systemic or system, those are when that's body circulation. So that's when blood leaves the left side of the heart and goes to the body. So systemic, if I say a systemic vein or a systemic artery, it's found in the body somewhere outside of the lungs. If I say pulmonary vessel or pulmonary, pulmonary anything, it's somewhere going to the lungs or within the lungs, okay? So just so we know the terminology that I'm going to be using and what it pertains to. If you look at a heart and everyone sees like a picture of a nice heart, this is what it actually looks like. This is on dissection. And when we do dissection, I'm hopeful that we're going to get to go in and do dissection. So hang tight. That's 8 weeks away. So we've got time. But normally the heart has a layer called the pericardium. It has a covering. So that pericardium has been removed. So the base is the widest part of the heart. The heart comes down to a point, and that point is called the apex. Normally when you hear the word apex, it usually means the top. But this point in the heart, it means the very point of the heart. If we look on the outside, there's an interventricular groove because the sides of the heart need to be, they are split, okay? They don't communicate with each other. So there is a dividing line. And then we have the auricles, which I'll get into. Now, when we look at a heart, where it is in the thoracic cavity, if we look at the ribs, it's about in the middle, but it's a little more cranial, okay? It's not, but it's really between ribs. I want you to write on here, when I'll type in here, the heart is between ribs 4 and 7. Approximately. And it points. So that's important to know, because if, when you go to listen to an animal's heart, okay, if I have a dog and he's standing like normal, about where the point of his elbow is against his chest, if you slide your stethoscope under where the elbow is, that's about at that 4th, 7th rib space. You may have to move a little forward. And I will tell you, when I listen to cats' hearts are just a little more caudal. So sometimes if you go to do the same thing to a cat and you don't hear anything, I'm always like, scoot your stethoscope back a little bit. Because cats, just as I said, they seem to be a little bit more caudal. But again, it's in the mediastinum. What is removed from this picture is the lungs. There are lungs on either side of the heart. So the heart is nestled between the lungs in that space called the mediastinum. You need to know what the mediastinum is. I like to ask that question because it's important to understand where it lives. Now, if you opened a dog's chest laterally and you open the ribs, the first thing you're going to see is lungs. You'd have to move the lungs, and then there would be the heart, okay? The apex, and let me show you, let me see if I can put, Hang on 2 seconds. Can you guys see what I'm doing on the screen? It should usually show. Oops. Okay. So now, if I'm pointing at this, or this one's a good one right here. If you see, do you see what I'm pointing at? This, if you count these ribs, now they are superimposed. So it looks, this is one side, this is the other side. But there's 1, 2, 3, 4, about 3, 4. Here's the start of the heart. 5, 6, 7, 8, you know, so you see where that heart is, but notice how that base is shifted. This apex is shifted caudal. Let's look at this one right here. What does anybody notice about that heart that's different than the other heart? This one versus this one.
It looks more rounded than it does oval.
Yep, it is more round. And if you look at this, this would be abnormal. The other thing is it's more kind of straight up and down. It's not shifted caudal. It's kind of like doing this. The other thing to, let me see if I find another one. But you can see in all of these what is similar. They're all pointed caudal. They're all about in the rib spaces. I will tell you, when we take a chest x-ray of a dog, if we have a dog we suspect heart disease, they're fainting, they're coughing, they're tired at home, we hear a murmur, we don't feel good pulses. When you take an x-ray, it's not going to completely diagnose what the actual heart issue is, but it's indicative of heart disease, because if I go back to this heart, and in the large heart, it could be cardiomyopathy. Sometimes there's tumors here that shift the heart in an abnormal position, but when you see an enlarged heart, also this black tube right here, that is the trachea. If the heart is swollen, sometimes it pushes up on the trachea, and it causes what we call tracheal deviation, and it alters the placement of the trachea. Yeah, and Ireland put a comment here, you could take an x-ray and show right atrial disease. Sometimes you'll see like a bulge on the heart, and let me do this. Okay, so if you look at this VD right here, this is the VD thorax, the dog is on their back, and you see there's a bulge right there. And if you see in this picture, they kind of outline it. So a lot of times on these x-rays, if a dog has heartworm, what it's doing is those worms are pushing out of the heart, and they will cause a bulge in the vessel. And you will see that, you can see it here, you can see it here.
Ooh.
Yeah, this was a lung thing, not a heart thing. But yeah, you can see right here, this has an abnormal shape at the top. Now, they would need further diagnostics. That's kind of suspicious of heartworm disease, but they would do a heartworm test, or they could do an ultrasound of the heart. I'll talk about that at the end, more into the testing. But I wanted to give you, yeah, and if the heartworm test on that dog was negative, atrial enlargement can be from mitral disease. It can be from hypertrophic cardiomyopathy. So there's a couple diseases that enlarge the atria, and that is indicative of more testing, so to speak. So I just wanted to show you an idea of what the heart should look like on an x-ray. And it, you know, again, this area down here is called the mediastinum, but you can see you've got a trachea. This is the lung here. There would be vessels here that they don't show up on x-rays super great, but it gives you an idea of what you should be looking for. Okay. So now, a lot of times the technicians, the doc says, you know, it's not our job to interpret radiographs, but all of us, as you get experience looking at them, you take an x-ray and you're like, you know, like Sean said, wow, that's round, or wait, that's not where it's supposed to be. So you know, you'll start to notice that, and then the doctor's going to order further testing. And like Ireland was saying, there's like a list. We're going to rule out if we see atrial enlargement. Well, the easiest thing I can do is a heartworm test. Why don't we do a heartworm test? Okay. The next thing would be a cardiac ultrasound. If it's heartworm negative, you really need an ultrasound, and that will measure the chambers, and I talk about that towards the end of the lecture. Okay, so what I was talking about that wasn't on that dissected image of the heart is the heart has a covering called the pericardium, peri around cardium heart. So it's a fibrous sac, and it's very dense. Like when you guys are doing dissection, you're gonna have to remove the pericardium, and you can't just like tear it off. A lot of times you're gonna have to take your scissors and cut it away and kind of peel it. But it protects the heart. And what the job of the pericardium is to produce a fluid, and it produces something called pericardial fluid. Pericardium is a noun. If I put it pericardial, it's an adjective describing the fluid. Does that make sense? So a pericardium is the structure. Pericardial is pertaining to the fluid. What type of fluid? Yeah, cutting through, we will actually, in dissection, we do things in steps, and I have you look at the heart first in the body. Like, I'm like, don't cut it out yet. You want to see like what it's attached to. And then usually on the third day, I'm like, cut things out, cut them open, look at the chambers, and, you know, and it's pretty cool. Remember, any lining, any protective lining like a serosa or the pericardium has two sides. Visceral is always facing the lungs, and the parietal, visceral is always facing the organ. Parietal would be facing the other way. So we've got the two layers here. It is filled with fluid. Now, maybe I should have stayed on. I'm going to show something here. Okay, I kind of tried to make this bigger, but I don't want to leave this page. Okay, I'm jumping ahead a little because I'm going to go over ultrasounds of the heart. But what you're looking at here, gray or whitish here, this is the muscle. This is the left atrium. This is the left ventricle. So this black fluid on an x-ray or fluid on an ultrasound shows up black. Tissue shows up in hues of white and gray, like bone would be white. The denser the tissue, the whiter it is on ultrasound. So we're looking at something called echogenicities on ultrasound, and it's the degree that tissues either absorb or reflect sound waves. That's what an ultrasound does. So anytime you see black here, I'm like, that's a chamber. Here's a chamber. This little flap right here is the mitral valve that we'll talk about. This white here is the pericardium. So all of this black area here, that is something called pericardial effusion. And effusion is, I'm going to type this because you need to know, I will preach about this more than you know. Anytime you hear the word effusion, it means in an area or a cavity, there is a buildup of fluid that is abnormal. Effusions are abnormal. You can get joint effusions. That means you have fluid on your knee. You can get pleural effusion. That's fluid in the thoracic cavity. You can get peritoneal effusion. That's fluid in the abdomen. When you get pericardial effusion, what happens is you have too much fluid between the sac and the heart. Now, I've already told you that sac is very fibrous. It's not going to stretch very much, right? So if fluid builds up, where is it going to put pressure?
Your heart.
On the heart. This can definitely be fatal. And I talk about this. Now, you guys are going to talk about diseases later in lots of classes, but I firmly believe When I was a student, I was like, why are you telling me this? Why do I need to know this? So I do talk about diseases because I feel like it's important to understand the difference between the normal function and what happens when it's abnormal. We had a Shar-Pei. I was working emergency up in Anderson, and the owner had called and said her dog was fainting or passing out. She thinks it's having a seizure. The doctor thinks the dog is having a seizure. It's an 8-9-year-old Shar-Pei. It actually gets in the lobby and passes out. Okay, so the receptionist rushes the dog back. We get the dog, and what I immediately notice is, first of all, the dog is extremely pale. He's not having seizure activity. He is semi-unconscious. When I go to take his pulse, I can barely feel his pulses, his femoral pulses, and his pulse rate was about 180 to 190 beats a minute, which I know you guys maybe haven't done a ton of heart rates. That's a cat heart rate. That is not a Shar-Pei heart rate. A Shar-Pei is a medium size. It's that wrinkly dog, if you don't know what I'm talking about. So they're about 30, 50 pounds-ish. Their heart rate should probably be somewhere between 120, 130 maybe. So 180, 190 beats a minute is extremely fast heart rate for this dog. The other thing was I go to listen to his heart. I can barely hear his heartbeat. I mean, I'm like, I can't hear it. And I told the doctor, she was a newbie ER doctor, so she's kind of new. She was still thinking seizure, and I was like, I think this could be an effusion. And we called our critical care specialist. He came in and did an ultrasound, and we found all this excess fluid. So what we did was, the first thing is when you see an effusion, what fluid is there? It's supposed to be a clear serous fluid. That's what serosal fluid looks like. It's just a lubricating fluid of the body. It's a water-like substance. What we did is we sedated the dog, put a needle in between his ribs, and we put a needle into the sac. Now, you don't want to go into the heart. So what the doctor does is he has the ultrasound probe, and it's about a 5-inch 14-gauge catheter is what we use. He puts it in between the ribs, and when he puts it here, I'm usually on the syringe and I start pulling fluid, and he's watching the heart. And when I start pulling fluid, it's like straight blood. So now we know this dog is bleeding into his pericardium. Okay, so we're barking up a different tree. But what's interesting is as soon as we start pulling off the blood off the heart starts expanding. And the heart goes from 180 beats a minute to 160, to 150, to 140, 120. It's kind of like, I can beat again. If you can imagine, it was stuck in this like sack of fluid, and then all of a sudden the heart can expand. And then all of a sudden I could hear a heartbeat. I could start to feel pulses. The heart could beat. Now, unfortunately, when we pulled that blood off, we saw that the dog had a mass at the base of his heart. So the dog had a tumor on the heart that was inside the pericardium, and that tumor was bleeding into the sac. Hopefully that makes sense to people. Now, some of these dogs, I will tell you with pericardial effusions, if you pull the fluid off the heart, the dog will feel amazing. I mean, they'll feel much better. He looked better. He was pink. His heart was good. The problem is, how fast does the fluid build back up? Within about 2 to 3 hours, the dog started showing symptoms again. He was getting wheezy. He was getting ataxic. He was tachycardic. We put him back on the table. The fluid had built back up. So not even in 2 or 3 hours. And the owners elected euthanasia. But I did have a case, because it was probably hemangiosarcoma, and if it's metastasized to the heart, that's not a good scenario. But we did have a dog at my previous emergency clinic. It was a Bernese Mountain Dog, and he had the same thing, a mass. When we would pull the fluid off his heart, he would do good for about 4 weeks. He had a very slow bleed. So the owner noticed when the dog started coughing a little bit or getting tired, or, the heart, we taught her how to check heart rate. We would bring him in, we'd pull off the fluid. We did that twice, and we got the dog an extra 2-3 months to live. if that makes sense. And it is sad. It is a sad disease, but like in that Bernese Mountain Dog, I'm like, we're not fixing your dog. You know, we can't change that there's a tumor on the heart, and that's a terrible place to do an operation. So what we can do is, hopefully if it's a slow bleed in the pericardium, we can just periodically pull off the fluid when it builds up and buy him some time. And it bought them some extra months. They weren't ready to say goodbye. So the Shar-Pei, unfortunately, had a very active, fast bleed, and it was just filling too fast for us to do that. So it was a different scenario. But I want to tell you, whenever you have a dog, you know, I taught ClinMed 4 last term, and it's cardiovascular diseases. Anytime you have a dog that presents passing out, lethargic, exercise intolerant, coughing, you know, those are all signs of an issue with the heart, but then it can be various issues, okay? This heart on an x-ray is going to look at the one that Sean said, this heart's going to look very round because that pericardium is swelled with fluid. But you can see that's not cardiomyopathy. It's swollen because it's filled with fluid. So that's why you can't just look at the x-ray and say, it's big and it's this or it's this. We have a list of things we think it is, and then we have to get to what it is. So I just want to explain to you the consequence of, here's another one up here. You can see that's the muscle of the heart. There should be just a very thin layer. This is all, and this picture right here shows this is an atrium. There's the mass. There's a mass right there pushing into that atrium, and that's the cause of that effusion. So normally that thing shouldn't be bumping inside there like that. That's an abnormal. So the ultrasound can diagnose all of that. And, well, look at that heart. If you're looking at it right there. It is not, we call that a basketball heart. Now, dogs with cardiomyopathy will have a heart that looks, with dilated cardiomyopathy, will have a heart that looks like that. But that, I mean, look at how much that trachea is being pushed up. Most of the time, the coughing comes from the heart can back up fluid into the lungs, but sometimes the coughing comes because the heart's pushing on the trachea. So the coughing, a coughing dog, we a lot of times think heart something, and then sometimes it's because of this. Okay. Well, I'll get back. I think it's important to, you got an anatomy drawing. This is what it looks like in a real dog. So if you have questions about that, just, yeah. Unfortunately, and I swore one day I'd have Dobermans. I got boxers right now, which boxers can get heart disease as well. But I will say Dobermans are prone to cardiomyopathy, dilated cardiomyopathy. So it's a genetic disease in those dogs, which is sad. Okay, so normally that's your anatomy of where the pericardium is. Now, this picture, think about if you cut into the heart and pulled out a piece, almost like you're cutting into a piece of cake. Like if you cut into a piece of cake and you pull it out, and you've got like frosting, cake, frosting, you know, you're looking at layers. What this is doing from this picture is looking, here is the outer layer, and we're working our way in. So you've got the most, now, when I say the outer layer of the heart, there's this surface of the heart, then there's the pericardium. The pericardium is like a layer that covers it, okay? It shows you that this is the pericardium right here. It says fibrous, there's a space. So that's the serous pericardium. You got that pericardial space. Then this whole chunk right here is the myocardium. Myo meaning muscle, cardium, heart. So you got a layer of myocardium. On the surface of the heart, there's a little bit of fatty tissue. That's why this is yellow. And that is where you have your coronary arteries and your coronary veins, okay? The coronary arteries and the coronary veins give the blood to the heart muscle from the outside. The heart does not soak up its, because the heart is a muscle and it needs oxygenated blood too. And you're like, well, it's full of blood. Why doesn't it just suck it up from the inside? The coronary arteries come around and feed the heart from the outside. Okay, we're going to talk about that. And then the most inner is endocardium. Just like I talked about endosteum, periosteum on a bone, endocardium is the most inner layer. They kind of have like these little channels or little holes called trabeculae, but endocardium, myocardium, and then you've got our outside, you've got this space, okay? You've got epicardium here, and then you've got a space, then you have pericardium. So if I was going outside in, pericardium, capsule, you've got a space, you've got epicardium, myocardium, endocardium, okay? And the papillary muscles are on the inside. There's little muscles inside called the papillary muscles. But if I'm talking about heart muscle, I am talking about the myocardium. So have you ever heard of endocarditis, which sometimes people get, talk about it in animals too? It's an inflammation of the inside of the heart. Myocarditis would be if the muscles are inflamed. Pericarditis is when we got that inflammation of the pericardium. And we get into that as well. Okay, so if we look at the basic picture of the heart, if we look at the drawing here, there are 4 basic structures: right atrium, right ventricle, left atrium, left ventricle. And then the muscle is the myocardium. So this very deep red here, or maroon, is the muscle. And then you have a series of chambers. One thing to notice is the atria do not communicate to each other, okay? The right atrium does not send blood to the left atrium. And then the right ventricle does not send blood to the left ventricle. There is a divider here that we'll talk about, which is the septum. So there is a septum. Now here, again, this pinkish red represents oxygen blood. So this is left atrium, left ventricle. This is right atrium, right ventricle, okay? The top chambers, the atria, and together the atria form the base, which is the widest part of that part of the heart, okay? Atria pertains to both. Atrium is one. And the way I think about it is if you go into like a hotel and it's got like these big windows, they're like, oh, look at that beautiful atrium. And you look up and it's like you see this atrium. So think about the top of the heart, this atrium. You have the 2 atria. The atria's job is to receive blood coming to the heart. So when blood comes back from the lungs or back from the body and it enters the heart, it's always going to come into the atria first. A comes before V. You got to go to the atria before you get to the ventricles. And one thing you will have to do on this test, and we're going to build this, is you are going to have to trace the blood flow through the heart. I will give you all the parts. I will give you all the information. You have to put them in order. An atria is always going to come before a ventricle, okay? They are separated by this interatrial septum, which is here. When they get full, so they dilate, when they're full, when they squeeze, they're going to push blood down to their ventricles. So when they squeeze, the blood is going to go down to the bottom chambers. They sit below the atria, okay, and they form the base. So right here, there's a base, they help form the base here, and then they narrow to the apex here, but they're at the bottom. So they are separated by an interventricular septum. This looks like one structure. During dissection, if you cut it in half perfectly, it's hard to tell between the interatrial septum and the ventricular septum. It looks like one, but basically a septa is a divider. Your nasal septum is right here. It divides your nose into right and left sides. The ventricular septum divides the right and left sides. So anytime you hear septum or septa, it's a dividing line. The job of the ventricles is to pump the blood out somewhere. So when the right ventricle pumps blood through the pulmonary artery. So here's the right atrium is the blue chamber. This is the right ventricle. When the ventricle squeezes, that blood is going to go out this vessel. This is the pulmonary artery, and that is going to go to the lungs. When the left ventricle contracts, it's going to squeeze out through here and it's going to go out. This is the aorta, and it's going to go out the aorta. Now, when you look at pictures of hearts, and there's only 5 million pictures out there. So if you start Googling hearts drawings, there's a bunch of different types. I'm working on editing the one that is going to be on the test because I want to show you the one that you need to know. But I know when you Google it, what's hard is these vessels are going kind of behind each other. So it's kind of like, well, when in the hell vessel is this, or this? Okay. It's hard to see because this is going behind the pulmonary artery. But this branch is the aorta. And then you see these little things here. That's where it branches to the other blood supply. We've got, it's going to branch to the carotid arteries. It's going to branch to the descending aorta. It's going to branch to the renal artery, which goes to the kidney. So when the aorta, this is why I talked about if this is the water company right here, okay, the big pipe leaving the water company has got a lot of water and a lot of pressure, but now it's going to subdivide and going to go to the businesses. That's going to be pretty big pipes. But by the time it goes to your neighborhood and then branches to your houses, those are small pipes, okay? That's exactly what's going to happen to the aorta. It's going to leave the heart very large with a lot of blood. But when it's going to subdivide to the front half of the body and the left half of the body, it's going to go to smaller parts, okay? So just to get an idea, remember, anytime I say pulmonary, talking about going to the lungs. Anytime I say systemic, it's going to the body. Auricles, not as important that you need to know. They're kind of these blind pouches that help with insulation and help with electrical conductivity that we're going to talk about. But right here, you've got the interventricular groove. If you go right there, that is where it separates the atrias and the ventricles. That's where it's going to subdivide off into splitting those chambers. And when I was talking about that fat in coronary arteries, here's some of that yellowing fat, and those vessels
Go upstairs
in that area. Okay. Auricle to what? Oh, the auricles, so they're a blind pouch. They lie on the top of the heart here at the base, and they provide an insulation and they help with electrical conductivity. So they don't really have a circulatory function, if that makes sense. They help insulate the heart and help with conductivity. I think since it's 9:06 and I want to get into the valves, but then I got to get into some other things about valves and disease. I think we'll stop there. Does anybody, and that gives you a chance to get ready for nutrition, or no, dog breeds, Tech 2, no, ClinMed 2, oh my gosh. Does anybody have any questions?
I guess I do. I think I asked my question wrong. You said pulmonary goes to lungs, and then you said something else goes someplace else. What was that?
Systemic is going to the body. Yep.
Thank you.
So, yep. So anytime, if it's leaving the left side of the heart, that's always going to systemic circulation. If it's leaving the right side of the heart, that is going to the lungs. So when blood leaves the heart, it leaves from 2 locations. It can leave from the left ventricle or it can leave from the right ventricle. The left ventricle has the oxygenated blood, so the aorta takes that oxygenated blood to the systemic circulation. When it leaves the right ventricle, it goes out the pulmonary artery, so it's going to pulmonary circulation. And I'm going to talk about, I'll give you a little tip about that. I'm going to talk about the size of the muscle of the ventricle. When you look at the left ventricle, if you cut a heart in half, and I actually have one saved from dissection. I put it in a jar because it was such a good heart, and they cut it perfectly. You could really see. I would ask the students, I said, look at this thick muscle. Which ventricle is this? And they were kind of like, and I go, just look at the muscle size. The left ventricle is a much thicker muscle because it's pumping to the whole body. The right ventricle has the easy job. the heart is right between the lungs. So it's like, I just got to pump right here. Imagine if you had to walk to school and you lived next door to the school and somebody lived 2 miles away. Who's going to have the better muscles? The person that's probably walking 2 miles versus the person that just has to walk. Like if you live in the dorms by school versus somebody was walking from 2-3 miles away. So the left ventricle is much more muscular because it has to pump with greater strength because it has to get that blood everywhere in the body. The right ventricle is like, yeah, I just got to pump to my next door neighbor, the lungs. So when you look at the ventricles, you cut a heart in half, I could take away all the color in the heart because they're dyed. The stuff inside the heart is dyed. So the left side would look pink and then the right side would look blue. But if I took away everything and I just showed you the muscle, you should still be able to identify a left ventricle versus a right ventricle, just based on the thickness of the muscle. So I'm going to get into the myocardium and I'm going to get into mitral valves, but hopefully that answered your question. Does anyone else have any questions? Oh, okay, well then my goal, as long as you typed here, which I think I got everybody typed here, I will get this recorded for you and posted later today. And I'm also going to try to get that picture scanned and sent to you. I have a heart image, and I usually send it to you guys blank. Maybe you can print it. Maybe you can edit on it. Maybe you can color it, but I will get that sent to you later today as well. Okay.